Thank you, Mr. Chairman, and thank you to the witnesses for being here today. I think it's important that we work across the aisle to make sure that Americans have access to what they need to live healthier lives. Sadly, we're seeing the current administration doing the exact opposite. This administration announced cuts of $4 billion a year from the NIH research funding. How are you supposed to find cures for cancer or new Alzheimer's treatment if research funding is chopped? Mr. Chairman, I ask unanimous consent to enter into the records statements from the American Brain Coalition, the Association of American Cancer Institutes, and the Association of American Medical Colleges that state and point out that funding cuts will halt life-saving research projects, cede America's leadership on scientific breakthroughs, and hurt our economy. You know, Mr. Kelly, our colleague on this committee, and I have legislation that incentivizes private companies who fund neuroscience research in partnership with academia and nonprofit research institutes. The administration's cuts would result in less opportunity for public-private partnerships like this one and throttle critical mental health research. UC Davis in my district does incredible work with NIH funding. They've developed diagnostic tools and treatment for individuals with autism, designed personalized medical approaches for cancer patients. They're studying the significance of critical research for Alzheimer's research and develop new ways to restore speech for ALS patients. And that's just a few of the things they do, and that's just in my district. NIH research around the country has produced tangible results from Nobel Prize winning innovations in gene editing to breakthroughs in cancer treatment. And NIH funding also positioned us to quickly develop the Trump COVID vaccine. This administration wants to cut funding through the entire healthcare spectrum, from research to treatment. Proposed cuts to Medicaid, discussed by some of my friends on the other side of the aisle, pose a great threat to patient coverage and hospital funding. Cuts to Medicaid would devastate rural communities through hospital closures and service cuts. And when hospitals in rural areas close or end services, patients in those rural areas have to travel many miles further to get the care that they need. When patients can't easily access healthcare services, as you all know, they don't get the routine preventive care they need, and then they end up in the ER to get more expensive emergency treatment. Patients, especially rural patients, get sicker, and we should be clearly aware of that.